Hey everyone, thanks for tuning in. I want to talk today about getting patients that are not really symptomatic to comply with your treatment plan. You've got a patient sitting in your chair, you see a disease state, ocular surface in particular, it might be dry eye, it might be blepharitis, it might be allergy, and you know you can help them, but they're not really screaming to you. That's not why I came in today. So really, and when I run around the country talking to doctors about dry eye in their practices, which I do quite a bit, I hear from them this is a really common complaint, a common concern. They don't know how to handle that. How do they manage that? What I like to do, there's a few things that I lean on. First of all, are they symptomatic or not? Make sure that's actually the case. They're actually asymptomatic. Have conviction when you talk to these patients. Share test results and show pictures and educate. So we'll run through each of those. Are they symptomatic or are they asymptomatic? Oftentimes we can ask questions, how are you doing? I'm fine, everything's okay. We use speed questionnaire. The speed questionnaire is filled out pretty easily by patients while they're waiting to see me. If they score 7 or higher on that, I consider them symptomatic enough that they're going to be on board with my treatment plan. It's a very well-directed questionnaire. I like it a lot. So have that done before they see you. Conviction. So this is a huge one. If you've got a patient sitting there with a problem, give them your best recommendations, but have the conviction you are making the right decision. You know, you see most of these diseases, they do well if you treat them early. If you wait to be more reactive rather than proactive, they don't do as well. So share that conviction with your patients. I think if this was your family member sitting there, what would you tell them to do? What would your recommendation be? But know that you're making the right decision. If you're not comfortable with that, read the research. A lot of us tend to pick up trade journals because we have a few minutes here or there. I'd encourage you to look at the references on some of those sometimes. Where these authors who write these blogs, etc., and these other articles get their information from. They get them from peer-reviewed literature. You can find these things very easily on Google Scholar. Look at an abstract. There's a lot of good information out there. I think a lot of us, myself included, could spend more time reading the research. But have the conviction that you are making the right decision. This is important. Confidence is king. If you have that conviction, you tell patients you got a problem, this is what we're going to do about it, this is when we're going to see you again, they'll do what you say. That's why they're there. They are there because you're the expert. Why are they wasting their time coming into you if they're not going to do what you want to say? So have the conviction. That's a big one. Test results. So we use a few. We use the inflammatory. We use osmolarity. We share these numbers. Patients like to see numbers. They don't really argue with positive test results, and I know confidently I'm making the right decisions based on these test results that I can manage over time. Pictures are a big one. We use pictures for blepharitis quite a bit. I used to epilate lashes and pull lashes and put them under a microscope to show patients mites. Now I pretty much just show them cylindrical dandruff. Lissamine green lights up really well. If you've got an anterior segment camera or a fluorescein staining, you can use certain devices like the keratograph to look at tear film breakup time. You can look at meibomian glands. The LipiView can do that. The LipiScan, a new device from Tear Science, does that very quickly on the lower meibomians. So images are very important. Most patients are visual. You can talk to them, but it's kind of hard to understand when we're talking in the anatomy and physiology of what's happening. It's easier to show them pictures. So use that. If you don't have these devices, typically you can even capture images on iPhones now. So there are attachments made for that. And finally, educate your patients. Make your best recommendations. Educate them as to why you're doing these things and why we want to do this. What are we going to do? Educate them. They may not do it. That's okay. You've done your part. You just need to do your best to educate. So are they symptomatic? Have conviction. Look at test results, pictures, and educate, and it's going to go a long way towards getting patients to comply. Thanks a lot.